So my name's Michael Wanis, and I'm a consultant urologist. I'm based at East Surrey Hospital in Red Hill, but I also have private practices based in Hawley and Ashted. So I come from a medical family, as both my parents were doctors. So growing up, seeing how my parents viewed medicine as more of a vocation than simply just a job was something that I found very inspiring. I've also been fascinated by science from a very young age, and I was drawn to medicine because it offers a unique blend of science and also being able to care for people. So interestingly enough, urology was the first medical specialty I was exposed to during my work experience in school. I started developing an interest during medical school, but it was during my core surgical training when I immediately knew that urology was the right fit for me. And it was for a variety of different reasons. Something that I found particularly appealing about urology is that we're constantly developing our techniques and staying at the forefront of cutting edge technology and innovation. So for example, using lasers to treat kidney stones and bladder tumors, and also endoscopic surgery, robotics, and even artificial intelligence. In fact, much of the surgery that we do is minimally invasive, which means that patients can go home on the day of surgery and recover a lot faster and get back to work and get back to their normal daily activities with significantly less impact in terms of complications and after effects, which is great. Also, many of the patients that we see come with symptoms that adversely impact on their quality of life, and so the treatments and interventions that we do are very much geared towards restoring and preserving quality of life. And seeing a patient before and after treatment in the clinic and hearing about the difference an intervention or treatment has made and how their life has changed for the better is very rewarding. So from my experience, I have found that patients value expertise and competence, but I feel that even more importantly, they really appreciate good communication skills as probably the most important aspect of building trust within the doctor-patient relationship. And in particular, I think patients value honesty and transparency, for example, about expected outcomes of treatments, because this allows them to have a more realistic outlook on a treatment and more realistic expectations from the future. And I think that's really important. And I found that in terms of what I value from my patients, that I learn something new from every interaction and every consultation that I have with my patients. I find that there's a lot of person-to-person variability in their own sort of personal experience of a procedure, and so I'm learning something new every day, and I feel that helps me deliver better patient-centered care.